experts speak on professional psychology and the treatment of female sexual assault victims. A presentation by experts, Uriel Davis, January 16, 2004, Psychology 496. A brief overview, professional psychology and the treatment of female sexual assault victims. Interpersonal sexual violence against women usually begin in childhood and continues throughout adolescence. Oftentimes, these assaults go unreported by female victims. Medical and psychological treatment is important to provide victims with supportive service to overcome the devastating trauma left in the wake of sexual assault. The experts will be discussing opinions on interpersonal sexual assault by physical and mental trauma, the possibility that severe and repeated sexual assaults can lead to the diagnosis of post-traumatic stress disorder in female sexual assault victims who experience brutal and/or repeated sexual assaults. Many female sexual assault victims fail to receive psychological and medical treatment due to being made to feel they are to blame for the sexual assault. What is the process for treating female sexual assault victims, and what mental and emotional disorders are associated with victims of sexual assault? Introducing our experts, Brianna Davis Reyes, PhD, board certified in forensic psychology. Expert 1. Employed by the State of Illinois Circuit Court Division over 10 years as an expert on assault cases, provides court-related assessment reports, and has testified in both adult and juvenile proceedings in areas of fitness to stand trial, sanity, risk of violence, and providing psychological service related to sentencing, mitigation, and sexual assault offenses. Provides private practice counseling for mental disorders for sexual assault and domestic violence victims, advocating for sexual assault and domestic violence victims. Expert 2. Ashley Reyes, psychological doctor, licensed clinical psychologist. Employed by Women's Treatment Center in Chicago, Illinois over the past 7 years. The Women's Treatment Center focuses on sexual assault services by providing group-based counseling for sexual assault victims. The programs offered are designed for persons with mental and substance abuse disorders, female sexual assault counseling, pregnant and postpartum women, and residential beds for clients' children, advocating for the safe haven for victims of assault. Expert 1. Dr. Brianna Davis. Dr. Davis promotes evidence-based practice in treating psychological disorder related to sexual assault victims. Dr. Davis recommends individual psychotherapy treatment in a private practice setting due to the perceived stigmatization that oftentimes occurs within the sexual assault victims, and psychopharmaceutical medication therapy as needed for anxiety and or depression. Rape victims should be referred for both medical follow-up, testing for pregnancy, HIV, and hepatitis, and psychiatric support. The patient should be encouraged to follow up with her primary care doctor. Right crisis centers can provide ongoing support, limited free confidential counseling, and legal services. Some jurisdictions may require mandatory reporting of rape, with identifying information either included or removed. For legal assistance for sexual assault, please contact Victims' Right Law Center.
Don't forget that. Go.
Expert 2. Dr. Ashley Reyes. Dr. Reyes promotes practice-based evidence in treatment of psychological disorder related to female sexual assault. Dr. Reyes believes a combination of cognitive behavior group therapy in a group setting in conjunction with psychopharmaceutical medication therapy for treatment of psychological disorders will provide the best results. That group therapy provides ongoing support from the other sexual assault participants in a group therapy. Sexual assault victims can find assistance with medical and psychological treatment at www.rvap.org. Compare and contrast. Expert 1.
Forget it, victims.
Victims need legal assistance and counseling. Pro-private psychotherapy counseling promotes legal actions for some. Expert 2. Victims need social support and medical care. Pro-therapy encourages safe havens for victims.
Sexual assault in the middle.
Sexual assault survivors suffer from post-traumatic stress disorder, which both Expert 1 and 2 agree. References.
See the list below.
See the list below.
It's better to get some than to not get it all.
Why is it not Control D?